Welcome to St. Luke's Health Now, a show dedicated to giving you the most up-to-date information on cutting-edge medicine. I'm your host, Ashley Russo, and we have a great show that you'll want to stay tuned in for. We're talking about weight loss, and we'll get an expert view into both medical and surgical options. We'll be joined by a panel of the leading health professionals in this field, hearing patient stories of success and taking questions from our viewers. Stay tuned. This is St. Luke's Health Now. Coming up on this episode of Health Now, an in-depth look at weight management with the team at St. Luke's. Stay tuned. Thanks for joining us. Let's get started. Meet Dr. Leo Claros, Section Chief of Bariatric Surgery and Medical Director for the Weight Management Center at St. Luke's, a designated bariatric center of excellence. Named a top surgeon by the Guide to America's Top Surgeons, Dr. Claros completed his surgical residency training at Harvard Medical School's Massachusetts General Hospital and Beth Israel Deaconess Medical Center. Dr. Claros also completed a fellowship in minimally invasive surgery and bariatrics at Tufts New England Medical. And he's board certified by the American Board of Surgery. He can be heard weekly on La Mega Radio in Allentown, Pennsylvania, where he serves as host for St. Luke's weekly Spanish language health information program.
The program that we have here at St. Luke's started in 2009, and it's a very robust, well-established, mature program. We are one of the busiest programs in the East Coast. We're very proud of what we have accomplished for our patients. We are performing anywhere from 12 to 15, sometimes 16 cases a week. That is by definition a high volume center. And it makes a difference because it means that we have the practice, we have the expertise, we have the experience, we have the furniture. We are a designated center of excellence. We have multiple accreditations and our results are second to none. I have been involved in medicine and surgery for about 16 years and never seen anything as rewarding as bariatric surgery. I'm very happy and just humbled to be allowed to participate in this kind of transformation and journey of our patients towards a better life, to a healthier life.
Welcome, Dr. Claros. Thank you so much for being here.
Thank you for having me, Ashley.
Tell me a little bit about what the St. Luke's Weight Management Program is and why it's such a unique approach.
The St. Luke's Weight Management Program is a well-established, mature, fantastic program that we have at the St. Luke's Health Network. We have clearly some of the best results, not only in the area, in the region, but around the country as well. We're very proud of that.
Yes, it's very astounding, really, to see this is such a recognized center of excellence right here in the Lehigh Valley.
That is exactly right. So I think what makes it unique is that the surgeons that work at the Weight Management Center were formally trained in bariatric surgery. And something unique as well is this is all we do, and it makes a difference. We're a high volume center, and we have an incredible multidisciplinary, multi-specialty team that helps us take care of our patients, and I think that makes a huge difference.
I'm so interested to hear more about this team approach and really why that unique specialized training is so important. We'll get into that a little bit later in the show, so thank you. Joining our panel next is Dr. Mahar Elchar, who serves as co-medical director of bariatric surgery at St. Luke's and was recently named one of the top bariatric surgeons in the United States. After a general internship at Drexel University Hahnemann Hospital, he completed his general surgery residency at St. Luke's and a fellowship in minimally invasive endoscopy and bariatric surgery at the University of North Carolina. Dr. Elchar is board certified by the American Board of Surgery and the author of Dr. E's Guide to Weight Loss, a guide for patients considering weight loss surgery.
So bariatric surgery is weight loss surgery, and it's basically performing an operation to induce weight loss. Patients who are eligible for weight loss surgery are patients who have a BMI of 35 and above. And BMI stands for body mass index, and basically it's a ratio of your weight to your height. I've done hundreds and hundreds of those procedures in the past, and every time I do the procedure, it makes me very happy and excited to see the patient lose weight and do well afterward. And I always tell the patient that what makes me happy following a procedure like that is to see you come back to the office off medications, looking good, looking healthy, and looking happy.
Dr. Elchar, thank you so much for being here this evening. I wanted to ask you, why is it important for a bariatric surgery program to be a part of a larger weight management program like it is at St. Luke's?
Well, first, thank you for having us. You talk about comprehensive weight loss center. In the past 20 years or so, things have changed, and weight loss now is becoming part of a comprehensive approach to taking care of patients with obesity. Obesity is becoming a disease now, and it's a chronic disease actually. So it's very important to approach the disease as a team. So at St. Luke's we have an amazing team of very well qualified, very well trained surgeons, dietitians, medical weight loss experts, social workers, whose job is to actually take care of the patient as a whole. We spend time with the patient to get to know the patient and also offer different options, including the surgical options, but we also have non-surgical option for taking care of our patients.
And I would imagine that's very comforting for patients to know that there are a variety of options, which we're going to talk about in a little bit. So thank you for being here.
Sure.
Let's meet our final panelist. Kate Boardman is the clinical coordinator for the St. Luke's Medical Weight Management Program. A board-certified specialist in obesity and weight management, Kate received her bachelor's in nutrition from East Carolina University and her master's in nutrition from James Madison University. She's previously worked in a variety of healthcare settings, including acute care, long-term care, and outpatient clinics. At St. Luke's, she works closely with patients on a variety of non-surgical approaches to weight loss, including providing ongoing monitoring, follow-up, and support. Just recently, Kate and her team were the recipients of Robard Corporation's Outstanding Achievement Award in recognition of exceptional performance and innovative contributions to the New Direction weight loss program.
St. Luke's helps their patients on their weight journey. So initially we'll help them set up their plan. What I think we really strive in is we help them not only lose the weight, but our whole goal is maintenance. And all throughout the program we're going to help them with challenges that they face, because we all face challenges, stressful events in their life. So we're the support system, hopefully, that they not only can come to initially, but feel that they can always return to as well. I find it very rewarding to help my patients on a daily basis, to sort of give them the tools to not only lose weight, but often maintain that weight and help them problem solve, and just let them know that it is a journey. There will be good days, there will be bad days, but just to help them feel better about themselves and empower them to to not only lose continued weight, or often maintain what they've already lost.
Welcome, Kate. Thanks for being here. You have a little bit of a different role on this team, and a lifetime of weight ups and downs can be really difficult on a patient. Can you tell me your role as a weight management specialist, and at what point do you generally get involved with patients?
Sure. Basically, our patient would come to our center interested in losing weight. Some of our patients had been down this road before, so they've easily seen a point where they've followed a program and have lost the weight and had regains. So we try to bring them into our program. We have different approaches. So we have a lifestyle intervention program. It's a 12-week program that gives them the support and education to not only lose the weight, but maintain the weight. And that's our whole goal. We want to help them change those dietary behaviors, because everyone can lose weight, but how do you maintain it? So that's what we really try to strive for in our program.
And it sounds like it's such a personalized and individualized approach to every patient.
Yes, very much.
Excellent. So. Thank you all for giving us a better basic understanding of your individual roles and the roles that your teams play. Coming up, we'll dig deeper into how the panel works together to solve complex medical issues and how weight management can be treated in a variety of ways. Stay tuned. We'll be back after a short break. You're watching St. Luke's Health Now.
I first went to St. Luke's because I was admitted in the hospital for congestive heart failure. I had high blood pressure, I was pre-diabetic, and sometimes it would be take a lot of energy just to even just do the simplest things. And that was a turning point where I knew I needed to do something to change my life. When I first started going to the bariatric center, I was 448 pounds. I went and met with Dr. Claros, and then he explained what the surgery entails, and then I met with the dietitian and the caseworker. Since I had the surgery done, which was about 4.5 years ago, things seemed like it was like a huge weight lifted right off my shoulders. I felt lighter than I've ever been. I was able to be more mobile than ever, and I had more energy. St. Luke's gave me the resources to save my life, and for that, I will always be grateful.
Welcome back. Thanks for joining us tonight. I'm Ashley Russo, and this is Health Now. We want to thank our viewers for providing us with questions, which we'll get to later in the show. Joining me is an excellent panel of medical professionals, Dr. Leo Claros, Dr. Mahar Al-Char, and registered dietitian Kate Boardman. We've discussed the weight management program at St. Luke's and their individual roles. Now let's get a better understanding of some of the treatment options available. Dr. Claros, you see a variety of patients in your practice. So what is your approach to assessing their individual needs as a patient, and then how do you decide the next steps they should take?
That's an excellent question. You should know that when a patient comes to see us in the center, we individualize the treatment specifically to their needs. We're going to tailor whatever we're going to offer them, once again, specific to whatever we think is going to be best for them. Unfortunately, there's a lot of places that might just offer only one surgery, only one intervention, maybe only one kind of diet, only one medication. That's not a comprehensive center. So when a patient comes to the office or to the seminar, we will sit with them, we will talk to them, we will learn about their past medical history, their issues, their needs, their goals, and once again, we will individualize and tailor specifically the treatment towards what we think is going to be best for them.
Dr. Al-Char, what are some of the qualifications and the numbers that people need to have in order to be considered for bariatric surgery?
Well, that's a very good question. The numbers are changing, but the numbers we go by today are the numbers that were put in place by the NIH back in the early 90s. And these numbers are BMI of 35 or more if you have a medical condition. But if the patient is healthy, has no medical conditions, is not taking any medication, the BMI has to be 40 or more. Now, saying that though, at St. Luke's we have looked into the issue of diabetes and BMI. If you have diabetes and your diabetes is not controlled with medication, and you're morbidly obese and your BMI is 30 or more, then you would qualify for a weight loss procedure.
So Kate, can you explain for us what the difference is between a medical and a surgical intervention?
Basically, from the medical standpoint, we're going to work on the core values of the meal planning, actually changing dietary behaviors. They definitely go hand in hand. We often use the same techniques as a surgical patient would do as a medical. They're just not doing that medical intervention at the time. But we work very much hand in hand. Often our patients will vacillate between the two programs. So I think our center as a whole, that comprehensive approach, the patient may start in one avenue, but then transfer to the other. So again, working towards the patient. Most of my patients would come with their motivations. I want to feel better, and I also want to improve their health. So I think they often have the same goals.
And certainly, as Dr. Al-Char said, there are many factors that come into play. You know, Dr. Claros, it's never an easy decision to get surgery, no matter what that surgery is. What are some of the other emotional and psychological things that you as physicians and as medical professionals really need to consider when evaluating a patient?
In all reality, I think one of the greatest fears, one of the anxiety a lot of patients have, they still consider the surgery is very dangerous. It's a very drastic operation, a very, a really important intervention. And this is a misperception. It's a wrong notion. I think, long time ago, these operations were very dangerous. We can perform surgeries today that are safer than a gallbladder surgery. Routine operations that we perform every day with my partner, with Dr. Birel, with Dr. Akusova in our centers, are very safe. So they're not reserved only for patients that are 500, 600 pounds, like the shows that we have on TV, My 600-Pound Life. The majority of our patients are middle-aged patients that are 100 pounds overweight, and those are the ones that we can really affect and help. So it's trying to explain to them that the surgery can be done very safely when it's done under expert hands in a good center.
Very important for people to know that the fear that they have perhaps is not warranted any longer. Dr. Elchar, I understand that some weight loss is required on the part of the patient prior to surgery. What are kind of those guidelines that someone has to undergo before you would consider them as a surgical candidate?
Well, our guidelines are very similar to the guidelines that other centers have in place. And some weight loss before the procedure is necessary for different reasons. First, we need to make sure that the patient is buying into this comprehensive weight loss center. We need to make sure that the patient is safe, so we need them to lose some weight ahead of time. And we also need to make sure that they're compliant. This is a long journey, and it's a struggle because obesity is a chronic disease. So we always try to make patients understand that we're willing to do the procedure as long as they're committed to the lifestyle changes that Kate talked about, as long as they're committed to being active, being exercising, following the instructions, because that's the key to success long term.
And it's nice to know that you as a team are there for the patients from day one all the way through their journey, whatever that journey may be. So thank you for all of this insightful information. We're not done yet. After the break, we'll learn more about the role of technology and communication in the process. You're watching St. Luke's Health Now.
St. Luke's weight loss program has been exceptional for me. The dietitians are great, the doctors are great, the PAs, everyone in the non-surgical weight loss program has been super great. It's not only a physical journey, but also an emotional journey. The dietitians really keep me on track, and they boost my morale, and especially when I get a little discouraged with the plateaus that I hit. But I always got through them and continued on my weight loss journey. The quality of my life has improved so much. I'm more active, I'm less aches and pains. It's definitely been a big improvement for my body. St. Luke's has given me the resources to get my life back on track.
Welcome back to St. Luke's Health Now, a show dedicated to giving you the most up-to-date information on innovative medicine. I'm your host, Ashley Russo, and we have a very interesting show tonight. We're talking about the nationally recognized weight management program at St. Luke's. In case you're just tuning in, I'm joined by three St. Luke's medical professionals, Dr. Leo Claros, Dr. Mahar Elchar, and registered dietitian Kate Boardman. Thank you all for being here. Kate, this is really an issue that takes a lot of members of the team. As we mentioned earlier in the program, often bariatric candidates are the kind of patients who have other health issues. So can you tell me a little bit more about the team that makes up the Weight Management Center and also how that team communicates out with the entire St. Luke's network?
Great. So we have a great staff, a wonderful support staff that the patient will meet right when they come in our door, which then will lead into a wonderful staff of dietitians, behavioral health specialists. We've partnered up with St. Luke's fitness centers, and we also have communication with exercise physiologists. And we all communicate about the patient, which I think is a wonderful thing, where if the patient's struggling in one of those areas, one healthcare professional will reach out to the other so that we make that health journey for them, as easy as possible and as pleasant as possible.
So this is not really just about that one visit that they're meeting with you
Right.
or with you or with you.
Exactly.
You're all behind the scenes communicating for the good of the patient, which leads me to the question, Dr. Elchar, of course the training is great, but the technology is also important, and the technology is changing really every single day. Tell us a little bit about how technology and robotics has come into play for your program at St. Luke's.
Yes. So things have changed in the past 20 years or so. We used to do those weight loss procedures in an open fashion. So a patient would come to a weight loss center and they will get a big incision. The problem with the open approach is that patients had tons of pain afterward. The complication rate was very high and the hospital stay was very long. So over time, we changed. And surgeons start doing the procedures laparoscopically. So this is the standard approach. So the advantage of a laparoscopic approach is that the incisions are smaller, there's less pain, the procedures are safer, and the hospital stay, for the most part, is an overnight stay. Now, we're looking into other technology as well. We're pushing the envelope, and now the new thing is robotics. The robot as a machine has something called remote center technology, so there's even less pain from a patient perspective, and the incisions are even smaller. So this is something I'm very proud to say that we are one of the few centers in the country that does robotic. This is great for the patients, and there's something that we're very excited about, and we're very proud of it, and we continue to develop that new approach for taking care of the patient.
Kate, before we get to the stage of even talking about surgery, when does a patient come to see you, and what are the first steps if someone's out there watching and they just want to know how do they get started? What do they do?
Exactly. Basically, our typical patient, a large percentage is referred by their primary care physician if they come in and maybe they've had a lab value that they're not pleased with, or they've seen a 5 to 10 pound gain over a period of time. Usually it's patient driven, and I think the neatest thing is when we see a patient that's come in and said, you know, I'm ready, this is the time, I'm ready, I'm personally driven at this point to lose weight. So many factors bring patients in, but we're just very glad that they come. It takes a lot to come in and say that you do need help losing weight, but we're very glad to help them at any stage that they're in and help them make those changes.
Wonderful. Dr. Claros, we mentioned a lot about this team and the training, the extensive training. Why is it significant that you and the other physicians are specifically trained in bariatric surgery rather than being a general surgeon who does bariatric surgery? Explain to us the difference.
It was recognized several decades ago that this is a specialty. When you come to a center where surgeons were specifically trained on that specialty, your surgery is going to be done much better, it's going to be done much safer, your chance of recovery is going to be much greater, your chance of a complication is going to be much lower. That's why it's so important.
Well, we are certainly so grateful that we've got you guys and this kind of staff and this kind of extensive training at St. Luke's. This is really good news for patients out there. Coming up next, questions from our viewers. Stick with us. You're watching St. Luke's Health Now. Welcome back to St. Luke's Health Now. I'm your host, Ashley Russo. A special thank you to our patients for sharing their stories with us and to our amazing panel of specialists. We've had a great conversation about weight management and the weight management program at St. Luke's and their unique approach. Now we want to take some questions from our viewers. All right, our first question is, and this is to any of you, what is your advice to someone who has had bariatric surgery somewhere else and isn't happy with the results? Do they have any options?
St. Luke's is a special place because it's truly a comprehensive weight loss center. We have very well qualified team of professionals, and our job is to approach and take care of any patient in a comprehensive fashion. So the main thing that we look into when we see a patient is to understand what's going on with them, why they're gaining weight, how come they did not lose the weight. Why are they having a complication? And usually we approach this as a team. You know, many of the patients that we've seen had a problem when it comes to the procedure itself, and we were able to do another procedure and fix that. But many of the patients do not have any anatomical issue. They have some social issues or compliance issues, and we can address those as well.
That's the beauty of our center, if I may add. You know, we will sit down and we will discuss as a multidisciplinary team, and we will find altogether what we think is going to be best for them.
And some of those patients will come to the medical side as well if they need that, and maybe join our lifestyle intensive program, which is a 12-week program that gives them that support, re-education, sort of go back to those dietary behaviors that they need to work on a little bit so they can get the help from a well-rounded.
Right, so possibly it wasn't surgical, it was just a lack of support in another way that your center can offer.
Yeah.
All right, I've got another question here. Will surgery be considered for someone with lupus or on blood thinners?
Yes, the short answer would be yes. We are, again, you know, a specialized, center and team, and we can take care of those patients. Unfortunately, insurance might have some requirements, and that depends on the kind of insurance an individual might have. But we do take care of patients that might have a wide array of different diseases and problems. So blood thinners, lupus, certain inflammatory conditions, we are prepared to take care of. And as a matter of fact, we are one of the very few centers that we have a lot of patients being referred from Philadelphia, believe it or not, from other major centers that we are taking care because of our experience.
All right, great. We've got time for a couple more questions. Kate, I think this one is one for you. What are some of the things that people need to do after surgery, and how can you help?
After surgery, basically, they need to just build on that foundation that they learned. We have an excellent pre-op education program for our surgery patients that teach them all the fundamentals, from dietary to behavior changes, and then really post-op, just put those into place. I think in our region, we offer one of the most comprehensive post-op care, I would say, for our surgery patients, which I think we should be very proud of, above and beyond some other centers. So I think that we're with them, a week after surgery, and then we really hope for that year follow-up. And all the recent literature, whether medical or surgical, shows that I would say weight maintenance comes from a constant, I would say, contact with a medical provider in that type of setting. So we're looking for those outcomes.
That's great to know. So you don't just get the surgery and go home.
Right.
You follow them for an entire year,
Exactly.
if not beyond. All right, the last question I have is, how fast do the medical conditions you mentioned earlier, such as diabetes or high blood pressure, resolve or improve after surgery?
That depends on the procedure, depends on the patient, and depends on how extensive that medical issue is. When we think about the weight loss procedures, we think about those procedures as metabolic procedures, meaning there's a metabolic effect that happens afterward. So from a diabetes standpoint, we know that following a bypass, for example, diabetes improves immediately afterward. Now, if you get a sleeve or a band, then the story might be different. Because you need to see some significant weight loss before you see an improvement in your diabetes.
Something important as well, we bariatric surgeons, the professionals in the team, we don't like to call these operations weight loss surgeries anymore. These are metabolic procedures specifically for that reason. The goal is to cure the diabetes, the hypertension, the sleep apnea, the hypercholesterolemia. And we tell our patients, this is what we're doing the surgery for, so you're going to be healthy. And as a side effect, you're going to lose weight.
That is a great way to look at it, because as we've learned here today, this is so much more than weight loss surgery. You're really, in a lot of ways, improving the quality of life and health for all of your patients. So thank you all so much for being here with us this evening. For more information on the Weight Management Center at St. Luke's University Health Network, please visit their website at sluhn.org or call InfoLink at 1-866-ST. Luke's. I'm Ashley Russo. This is St. Luke's Health Now. Thanks for tuning in. Until next time, be well, and remember, it's important to focus on your health now.